time.
The leader of opposition, Betty Aol Ochan, has questioned the procedures government is using to screen truck drivers crossing the country's border points against COVID-19. Ochan says all drivers must be quarantined for 24 hours as they wait for their results before being let to go. Ochan's concerned the follow reports that 2 truck drivers had tested positive hours after they had crossed the Malaba border. One of the drivers has since been intercepted at Kamdini, more than 500 kilometers away. With me is Habad Ziwa, currently at Parliament with the leader of opposition. Habad Ziwa, if you can hear me.
Thank you very much, Andrew Chamagero, and our viewers wherever you're watching from. We are here at Parliament with the leader of opposition who has some concerns in the way the Ministry of Health and Government is carrying out the testing of truck drivers, especially those who are coming from Kenya. I remember this exercise started this week, and so far many of them have been tested. Honorable, thank you very much for accepting this interview. What exactly are your concerns? Because previously people were calling on government to test these truck drivers, especially those coming from Kenya. Now, what is your concern?
Yeah, thank you very much. Yesterday in the evening, I had the hardest time with very many people from Gulu calling me, and they were really under pressure of fear. And this was about a truck driver who went through Malaba and came up to Kamdini. He was tested. If he was tested, found positive, how did he slip through? And I usually think that when a person is tested, you first give the results before the person is left to move. So this truck driver was tested and left before the results. And he was found in, now he was traced and found in Kamdini. Kamdini is in Lao sub-region. And I think the instruction from Ministry of Health was to send him quickly to Gulu Regional Referral Hospital. And you know, the people of Gulu still have fresh memory of Ebola, how Ebola attacked people. So any disease which is contagious, they will always try to be very fearful. And all the calls were about the fear of importing, that is, getting corona from somewhere else to Gulu.
Honorable, your concern is that this patient, having been intercepted from Kona Kamdini, should have been either taken to Lango Referral Hospital or back to Kampala, Mulago, or Entebbe. Yes. That is your concern. Why? Is Gulu Referral Hospital not equipped to handle such patients?
Well, even if Gulu Hospital is a regional referral hospital is equipped, I was there on the 10th to check on a child who later even died on the 11th. I'm telling you, people now fear the hospital, and it's not so friendly. And my belief is that Gulu Regional Referral Hospital is not properly prepared. No wonder the other one, who one time escaped, the other man who escaped from there, escaped rightly. Ministry of Health need to do more meaningful work in Gulu Regional Referral Hospital. But beside that, even if Gulu Regional Referral Hospital was well prepared, it is indeed proper for us to contain a contagious disease from where it comes from, not to try to export it everywhere or to import it everywhere in the country. If Gulu district was still free from corona, why do we have to import corona there? So this, I have raised it as a concern also to demystify the view that the people of Gulu are tribalistic. We are not. Go to Gulu district, you will find that even the chief administrative officer is from a different district altogether. The division commander, the DPC, even the director, Regional Referral Hospital, is not a person from Gulu. So we are not tribalistic. Our view is that the people fear. Okay. They still have the stigma of Ebola. Okay. So anything contagious, but also principally, the Ministry of Health should rectify this, where somebody is tested and then left before what? Before getting the results. They should get the results first before the person is left. This has brought confusion and stigma also on Gulu people. We are not tribalistic. We want this handled properly, and we need to crush corona altogether. One Uganda, one people. That is our motto, and we continue to move around.
All right, thank you very much,
very
the
much
leader
for
of
the
opposition.
opportunity. Thank you very much.
You,
Everybody who is seeing me,
I'm surprised you didn't forget one Uganda, one people, your slogan as a member of the FDC. She has been giving us an insight on how she thinks this pandemic should be handled. Back to you, Chamagero in the studios.
Thank you, Albert Zua. Those are opinions coming from the leader of opposition in Parliament.